We have a doctor who is joining us online, Dr. Maya Valecha. She is MD gynecologist, but she is a social and political activist. She hails from Baroda, Gujarat, and she, along with her team has drafted this letter, okay, to Prime Minister. And Awaken India movement has also done an excellent job, and we are sending again a letter from AIM. So let us see what she has to say regarding health bill and the issues. Okay, so can we have Dr. Maya Valecha online? Yes. Hello, Dr. Maya Valecha.
Hello, Dr. Gayatri. huge, I mean, clapping for your effort. Uh, since morning, we are listening what all blunders have been done during this Corona period, and our worry doesn't end here. I'm not talking about fourth wave because they will not be able to bring fourth wave. Their 22nd June is just nearing, and they are trying to scare the people, but people are not getting scared now. So that is one thing. But because people are not getting scared, now more is to come, and that is this new public health bill. What all blunders are committed during the corona, nothing has been actually learned from it. But actually, what is being done is what they could not do without any law, they want to do it with a law now. Now, as Dr. Gayatri has said, that yes, we under Jan Andolan have written with more than 3,400 awakened citizens signature, in which doctors are there, lawyers are there, then concerned citizen actively working in this field have signed and written to the Prime Minister, Chief Justice of India, then Health Minister, and Standing Parliamentary Committee for this matter. Why we? Because the bill is still not shown. It's maybe they are drafting still, but it's not shown to the people. But it is shown to the media houses who have reported that it will be a 2017 bill plus lockdown will be defined and a proper. They are telling that they will allot the duty, but actually it's centralization. So why we are opposing it? Why so many people, so many awakened people, doctors, lawyers have opposed it? I'll just briefly tell you. One thing it does not address, as before me, so many speakers said that our problem is the public health issues of our country are related to malnutrition, pollution, or infrastructure related, or social and economic realities of their life. That is not addressed. And can we address such a thing in health bill? Yes, there was a bill which was drafted in 2009, but then nobody pushed it for it. So even in a health bill, all these problems can be addressed. But even housing was addressed in that particular bill, which is required for a healthy life. So this particular bill, we allege, and it's very clear from its drafting, that this is solely to fulfill the legal obligations of international health regulation, that is part of WHO, and a new treaty with WHO is coming. So the bill is not for our health, but to fulfill the legal obligations with WHO. And what is WHO? We all know it's not, all the governments are represented there, but still it's funded not by the cooperative effort of all the governments, but in major part it's funded by pharmaceutical companies. And it's not my allegation. During swine flu episode, European Council had fully investigated that how WHO, under the pressure of pharmaceutical companies and with the collusion of all the governments, because many a times we feel that is it possible that all the governments throughout the world are corrupt? No, Yes, it has happened during swine flu. This report has said that with the collusion of all the governments under the pressure of pharmaceutical companies, WHO created a pandemic, or say warned a pandemic, and which, when it was not there, somehow that particular time it got aborted because of a very toxic vaccine in the Europe. So, what we have vehemently opposed is that we will not have any treaty with the WHO. We have our experts. This particular 2017 bill has many provisions which we can say we have not learned anything out of Corona. With WHO, they have mentioned that when WHO declares an emergency, a health emergency, we will take action. But nowhere it is mentioned that once the WHO declares, our health experts will evaluate the situation here in India with the what exactly we are facing. Are we having that numbers? Are we having people dying? No. This time also during Corona, three major public health experts associations has said no for the complete lockdown right on the day one, but it was imposed at whose instruction? So, and we all know that lockdown doesn't stop anything. The lockdown, WHO's own past experience says that virus is here and no lockdown can stop it. Right in the 2 months, more than a crore of Indian people showed antibodies for it. And nothing devastating happened. As Dr. Raman showed, nobody died in 2020 actually. So, we don't want external experts who don't know the Indian reality to decide the fate of our country. That we have to assert. So, another very worrying provision in this 2017 bill is that not actually the outbreak itself, but even if there is a likelihood of outbreak, then any government officials from district to central level can declare all these measures. And what are these measures? They can enter your houses, they can test, they can seal the building, they can medicate whatever they want, whatever is the guideline, and they can vaccinate. Right now we have vaccination voluntary, whereas in this particular bill, by order they can vaccinate. That's what is the, it's written. They can kill the animals at the slightest suspicion of some outbreak. It's not the outbreak itself, there is likelihood of outbreak. So can seal buildings, can close the schools, can close markets, whatever we saw out of fear, now they can do it everything legally. You can't even, and this provision that when this particular act will be in force, all other our previous rights, all other acts are overridden by this act. That means our fundamental rights are practically suspended. There's a provision that you can't so easily, this time at least we have tried and got some success in the courts, but there's a, in this particular bill, we can't go to courts also that easily, because then the courts cannot take the case unless the higher officer has given the permission to. So these are this law. And there is one more important thing is centralization of power. As I said, anytime center can take over the state if they feel that the state is not doing properly, or if any IAS officer is not acting as per the center's direction, they can take action against him. So total centralization, it's a completely authoritarian takeover of our all rights. So what we have decided in this particular letter to Prime Minister and all others, that before bringing any bill, there should be a wide public discussion on it. As we, it's our experience that this government is in the habit of without proper, not only public discussion, even in the parliament, hardly there's any discussion and they pass the bill. Now, as Dr. Gayatri said, we doctors are hardly know that such a, I mean, 4 big media houses have reported it, and we should see what's happening in the field of health. But we are not concerned about what's happening. I'll tell you in the end why we should now, not for the public, not for the people. It's for our own sake, we will have to take all these things into cognizance. So second thing is define pandemic or epidemic. WHO has already diluted the definition of pandemic. It used to be that if so many deaths happen, then only the pandemic can be declared. But in before swine flu, they diluted the definition that just by having number of cases, we can declare pandemic. And now this RT-PCR test, which I don't know whether, but it's not a reliable test. It's not a diagnostic test, not only from cycles to its, I mean, we know CDC has replaced the test, but we are still continuing with the same RT-PCR test. And that particular test, apart from with COVID or just because of comorbidity, the test itself, I mean, when 85 to 90% of the people are asymptomatic, I mean, for the first time we found. So what we have demanded is that such, it's again emergency use authorized test. It's not a completely approved test. So we have demanded that such a test will never be used in future. Endemic should be proper, epidemic should be properly defined, that more than 2 standard deviations above the last 3 years. So we should have proper record whether there are any increase in cases as compared to the last 2 or 3 years. Secondly, with complete decentralization. In such a vast country, we know hardly few states with this particular test also. Not all states were having equal numbers. 4 or 5 states actually showed the number. And we can't impose a centralized policy. Local experts, not only government experts, but people working in the field, concerned citizens also. These days, there are so many people who are concerned about what's going on in the society. Everybody should be given chance to give their opinion, and people should be consulted whether actually there is anything like a disease going on in the area, and then only the area wise people will take the decision. Complete decentralization of the decision making process is demanded in our letter. Then in our country, we saw right now Dr. Abhay Chheda, who and similarly, apart from allopathy, we have Ayurveda, homeopathy, then Siddha, then Unani, then yoga and naturopathy. So all these branches have the rich experience and treatments. So we should give equal importance to all this, has been emphasized in our letter. And not only during the pandemic and epidemic, but during the normal course, all government hospitals should provide all these facilities, all these knowledge systems to the people of India. No lockdown. That we have emphasized this particular part very, because we know what all lockdown has harmed. Not only that it doesn't stop the virus, not only that it has no effect in either. It's good that in most of our country, people have not followed lockdown. People got exposed and we are immune now. But economic life was destroyed, and people are now facing, 80% of the people, as per the report, are having food insecurity. So what we should do is we should learn from the corona experience, and accordingly what we have experienced in our country, we should make that the increase in deaths number in 2021 is simply because of the lockdown effects. People couldn't take medicine for other diseases. People were socially, economically insecure, and which has actually deteriorated their health. Now we doctors, all awakened doctors and many minister, but all other doctors now should come up, and we have to raise our voice. See, doctors in Belgium raised their voice right in the 2020. There are more than 1,500 doctors have written letters to the governments of 30 countries. right in 2020. So let the doctors in our country rise and prove that yes, we are really for the health of the people. And we should oppose this bill. And we should oppose all these unscientific things that we have done during these 2 years, not only because it's our duty, but just think, just our own enlightened, what I would say, our own interest. If the economy as a whole goes, yes, few people did get a chance to earn in this pandemic, but if in the long run, if the economy as a whole goes, if the whole ship is sinking, we cannot remain afloat. That is number one. Our kids suffered because of the online education. They have not they are not educated. They will suffer for their lifetime. Dr. Bhaskar Raman and myself are doing a lot of things on this also, that we can earn, but we cannot make the future of our children for this lost years. So if we want, as Dr. Amitabh Banerjee says, do we want our country to become Shanghai, locked people inside their houses across those meshes, someone testing you, someone medicating you, someone vaccinating you? Do we want that kind of thing for the future, or we want a free life? The way we say, it's not the, I mean, all we have seen this, it's not the virus, it's not the bacteria that kills us, it's the asocialization, it's the economic destruction that has killed us. And they want to bring this bill with association, I mean, with the full instruction of WHO, that they can bring such things, such tyranny to our country again and again. We don't want this, and we have to oppose this bill, and we have to oppose the WHO treaty. Thank you, Dr. Gayatri.
Thanks, Dr. Maya.